Hey guys, this is Daniel Aragon. So today we're going to be talking about the ED wait times and why you're there for so long, and what the process is and why people actually skip the line, which is and can be very annoying. So the first thing that happens whenever you come into the ED, you're seen by an ER triage nurse, and the triage nurse is simply gonna ask you a couple questions of um, why you're here, how did you come. So if the patient, if she sees or he sees, the triage nurse sees that you come in your own car or you're coming from an ambulance, so that'll give them an idea of how severe what's going on actually is, right? So they'll ask you for what symptoms you have, what happened, what brought you in, and will assess all your symptoms and your risk of having some severe or life-threatening illness. And then she or he will put you in one of the five categories of triage. Sometimes with mass casualties, the triage thing is colors, and at some other point is like most of the EDs they use numbers, so 1 through 5. Um, so once they give you the triage asks you a couple basic questions of what's going on. They'll give you a number and then they'll ask you to wait in the lobby again until they find a room for you in the ED. That's assuming that it's full, right? If it's not full, they just room you immediately. So actually, triage, the method of triage can be done by anyone in the medical profession that knows how to do it. It can be nurses, it can be doctors, or anyone else that actually knows how to perform triage. And it's just to look at for serious illness, life-threatening conditions. So it could include chest pain, difficulty breathing, shortness of breath, having skin blisters, um, having anything, and then they'll rate you from 1 through 5. Um, so like if you're having chest pain that has been worsening, and now before it was just because whenever you were running you were doing exercise, but now it's at rest, so that's a little bit more serious than just I have a cough and I haven't been feeling well, right? So they'll take your temperature, they'll check your vital signs and everything, and then they'll give you that rating. Um, the triage nurse will put you into one of the five categories, so 1 through 5, with one being the most urgent. So a patient who has um, um, chest pain that has been worsening and tightening chest pain. It's not relieved by medications, has been taking other medications, but still not working. So they'll get a 1. Patient who stubbed their toe and is a little bit bleeding, but it's almost stopping, and then they'll receive a 5. And the doctor will see you whenever all the other emergencies are not there. And of course, these categories are based on how severe your symptoms are and the likelihood of them actually getting worse is, and how long it has been going on. So if it seems to be not that bad, but it's quickly getting worse or can get worse very quickly, then you'll get attention very quickly. So let's say your grandma has been at home and has been having some difficulty breathing and has lately been a little bit more sleepy and has been breathing faster than usual but not as deep, and it's not very comfortable. And then we get labs and everything looks fine, but the fact that everything looks fine is actually worrisome. um, so a patient, that type of patient, your grandma would likely require more attention quickly and will skip the line and have a category of 1 rather than a 5, and will be seen much quicker. So there's no set time for each category as to how quickly they need to be seen. It's just as soon as possible. But in general, most hospitals try to see category 1s, which are the most severe, within 10 to 15 minutes since they arrive in the ED. Then category 2 patients can be seen up to 1 hour. So it'll vary. Whenever the emergency room is full, category 5s sometimes just get better and they say, hey, it's not worth the wait, and they just go home, or they'll just stay there and then they'll wait multiple hours, like 12 hours, to be seen. So next time you're in the ED and you see that patients are skipping ahead of you, getting treatment ahead of you. It's not because they are VIPs or they're more important or because they have more money. It is simply because they require more treatment. So the purpose of triage is to use the resources that we have. We have limited time, limited money, limited materials, and we want to give it to everyone in the best way possible to have the best outcomes. Um, so it's very important to be able to categorize people in a way that we use our materials, our time, our money, uh, the best way possible. And this brings up a very important point in which you should have a primary care doctor that for all those stabs, cuts, and wounds that seem to be minor, that instead of waiting the ED for multiple hours because there's a lot of emergencies coming in and you don't go up in the line, go to your PCP and they might be able to help you out much quicker and more efficiently, and you won't have to spend all night in the ED waiting to get care.